our healthcare system is bullshit, right? That's it. That is fundamentally true. So starting from that point, anybody that you talk to that tries to persuade you that it isn't, you know what's coming out of their mouth is largely bullshit.
We have Mike Stancil joining us on Postindustrial Talk. Mike is the president and CEO of Pittsburgh Business Group on Health. We have all their details in the description below, but Mike, start us off by just telling us what that means.
Yeah, it's a little tough to decode, right? So the Pittsburgh Business Group on Health is a nonprofit coalition of employers. So, most of us, we all work for different companies, different organizations, and those organizations provide us with health insurance. And as a result of that, employers are the biggest purchasers of healthcare products in the United States. And in that, they have a lot to say about the quality and the cost. So it's a way for employers to work together to make sure that their employees and themselves are getting the best possible health care at the best possible cost. And those are two things: care, quality of care, and cost, that in the United States are really, really big issues. So that's what we get to work on. We got a lot of heavy hitters in our region that are engaged with us, and large employers that work with us, and we've been very instrumental in a lot of really cool things. Most notably in recent years, the hospital pricing transparency, making sure that you know exactly what everything costs when you go into a hospital. We were big proponents and advocates behind the no surprise billing legislation that went through a few years ago. And right now we're trying to help everybody navigate some really, really detailed reporting that is required after some legislation was passed, basically naming your HR person, the person that Susie HR or John HR at your organization. They're now the legal fiduciary of all your healthcare spend. So their jobs and are on the line, and they can be sued if something isn't done right. So we're trying to make sure that they get everything that they need.
Okay, so now we know about the nuts and bolts about what you do. Let me start you off with a softball question. Why is American healthcare so goddamn expensive and hard to figure out?
Yeah. You ever heard that like Carl Sagan quote that's like, if you want to make an apple pie from scratch, first you have to start the universe. Like it's kind of that, right? And that's a paraphrase. That's not a direct quote. The problem with U.S. healthcare is that it started off from a place of like barriers of understanding, right? Like if you just go back to the fundamental ideas of what is understandable and what isn't, medical knowledge was one of those things that was reserved for the elite. And that never changed. So you take that starting point, which is why all medical languages in Greek and Latin, right? These were the languages that the common people they were not taught. And you add to that the capitalist market, right? And I'm not saying capitalism is good or bad, but I'm just saying it's driven by efficiency and profit. And if that's your fundamental sort of goalpost, that sort of ever-ending pursuit of profit, then you're never going to stay on the path towards better healthcare, right? That's gonna steer you at some times, right? Because you actually have to deliver to the market something that works, but then you have to extract as much profit as you possibly can. And so those two forces kind of pulling against each other, the fact that nobody had a clear view into what was happening, at the same time people were operating with profits in mind. You do that over 100 years, couple hundred years, you're going to end up with a really broken system that is not aligned with what healthcare is supposed to be, right? We're so far from the Hippocratic Oath at that stage that it's kind of one of those things where if we really wanted to fix it, we needed to kind of strip it down to the studs and rebuild. But that's very difficult to do, and nobody's willing to do it.
That's a good point because of the profits involved. But, there are other countries in the world with capitalist intentions in mind, foremost on their minds, and reasonably democratic elected governments where they have national health care. I've benefited from them greatly in the past. I've had injuries prior to this one. I used to. I have a jacket, a medical jacket about yay thick. Let's just say like this. I've had my fair share of dings and scrapes other than the one you see on me. But yeah, I was injured once, a couple times in Brazil, in which I had to seek medical care, and I went to the hospitals there and I received fantastic care, and it didn't cost me anything, even though I wasn't a citizen. And then I went to have private care follow-ups after I'd hurt my shoulder and I had a injury on my face from a surfboard that lacerated me right here. And then, the care was reasonable. Even if I went to a private hospital, it was far more reasonable and the quality was excellent. I've had this happen to me time and time again. And I'm not asking you to go through the history, and yes, it is difficult to change, but what is an organization like yours doing to help employers find reasonable alternatives to large, expensive healthcare plans? How does that work?
Yeah, so right, I do think the US's resistance to change, right, is that profit-driven piece, right? So on an individual company by company basis, even the organizations that are nonprofit, right, they're still run by boards and shareholders that are looking to maximize the footprint and the revenue of the organization. So it's just, and so they're never going to approve measures that significantly reduce that. So on a company by company basis, you've got resistance to fixing the problem. So that's, sort of your larger question there. Like, why do other countries have this, but we can't? We're so far down the pipeline with it that trying to steer back in that direction, I think, would require, well, it's going to take a long time regardless, right? It's trying to change direction on the Titanic, but like it's, I think it's one of those things that is, there's a social aspect to it too. And I don't want to like digress too far into that, right? But there's not alignment, right? You know what I mean? There's not alignment all the way around the country. And in order to like really revolutionize something like that, you have to have all parties kind of, or at least most parties, pointed in the same direction. So what does the PBGH do? And that's the Pittsburgh Business Group on Health, because I realize we throw out these acronyms and then expect people to keep up. So because we are a large market force, we can force our vendors, the people that we're buying healthcare from, through collective action, to meet standards that we have decided are necessary to meet. I think one of the most recent sort of market responses, and it's funny because you're seeing this battle take place in a lot of like in the public discourse right now, and even like against companies around DE&I and equity, right? These are kind of third rail words right now, and people are politicizing it. Well, during COVID and after the murder of George Floyd, it became a major priority for our coalition, and there are coalitions just like ours all around the country, and we all aligned that equity needed to be a major issue. And within months, somebody's delivering something. I apologize.
No worries.
She's mad about it. My dog Olive. She's so frustrated by all
protecting you.
Yeah. So no. So so we all aligned that this health equity was a major issue, and within a few months, the vendors responded, the insurers, the healthcare products, and it became a part of their standard like proposals. When we would put out RFP, it would be, here's a slide on what our product is, and the next slide would be, here is our core approach and steps that we put in place to address health equity. And we're like, okay, awesome, right? That is like, when that becomes like that's what you want, right? You want the issue that you're looking at to become table stakes, and that's very much what happened. And that's not rolling back. For as politicized as all the rhetoric has gotten around these types of things, they still show up and present and talk about equity in their offerings. And the reason is one, it's important. We're actually in this business to help people and to heal people. But if your benefits aren't being applied equitably across your entire population, then that means that there's an entire portion of your population that isn't getting the care they need. And there's a business case for that, right? It's not just hearts and minds. That's a
she agrees.
Say louder for the dog in the back. So there's a lot of momentum behind that, and are we
That's
able
okay.
to like cut some of this?
Yeah, you can. Yeah, we'll cut.
All right.
We'll take
I'm
a break.
Put her in the crate. Here's the troublemaker.
Oh, let me see the troublemaker. Oh, you're such a good. What's wrong with you? There's nothing.
Apologies.
No worries.
Okay.
So let me restart us here. It sounds to me like we need more organizations like Pittsburgh Business Group on Health that are taking the large health insurers to task to say, hey, this shouldn't be this expensive. These are the kind of deals that you're helping employers get. Do we need more organizations like yours that help make it fair for folks?
Yeah, I think, well, yes. And I think that's a longer term thing, right? Like anytime you get so that sorry, there's a short yes and there's a long yes.
Okay.
So the short yes is yes. Anytime you have employers in given geographic regions working together to help within their specific healthcare market, because all of ours are different, that's incredibly important. That's incredibly helpful. We have a national footprint through the National Alliance of Coalitions. It's called the National Alliance of Healthcare Purchaser Coalitions. We just call it the National Alliance for short. And that's how we all collectively work together across the country. And they're in the process. They help build and seed new coalitions. So having new coalitions is good. But really, like for us on a daily basis, it's having local employers engage with us, right? So as new companies come into the market or new places like new companies form or relocate or are born, having them join the coalition not only empowers us, but it actually gives them a voice. So, we have the 10 to 15 largest employers in the greater Pittsburgh area as members. And that is a strength that we have. But, Pittsburgh's economy is changing. We've got new companies coming in all the time. And if they're not joining in and they're not participating in the conversation, then, in our region, there's a couple powers that really control a lot of things in healthcare. And that's not good or bad. But if the employers aren't organizing, then they're basically just being told what they can get and how things are. And you're never going to change anything if you just sit back passively and let people hand you things over and over again.
So the key is for there to be responsible, employee-minded employers out there who also probably want to save a buck or two on the insurance that they're providing and making sure that the quality of care keeps their employees happy and productive, right? So
yeah,
technically that's how it's supposed to work.
Yeah. And it does, I think, in some regions better than others. But I'll say this, and I probably shouldn't, as the CEO of one of these organizations, is we're a force for good. We are trying to make a difference, and we are making a difference in a lot of ways, but we're never going to fix the problem. I mean, realistically, right? We're not the panacea for all of the healthcare woes in the United States. It's like, I feel like we are a force. I like to imagine it as like two dots, right? Which is like one is patient outcomes and the other is profit, right? And healthcare should be pointed at this all the time. And it's okay if it's split in the line or if it curves out towards profit to make innovation and everything like that. But it's not. It's pointed at profit all the time. And what we're doing constantly is trying to pull its attention over this way. And we can pull and pull and pull. And that's what we do so that we keep it going that way. But the second we let go, right, it goes right back here. And yeah.
That requires vigilance then, not only on your part and these organizations' part, but of the people like myself who are, and I'm just only speaking for myself, woefully ignorant about how healthcare works. That's one
Yeah.
of the reasons why you have a column at Post Industrial writing about healthcare and addressing these hard questions, and here today talking about it, not only for the edification of our audience, but for me as well, because for someone who has as much metal in their body as I do, I don't know nearly enough. And I feel
Well,
like I'm not, alone in this.
no, and I'll say this, right? Like, and I certainly don't know everything. I'm in it a lot of the times, and I sit on stages and listen to people, and the strings of words that come out of their mouth,
Mhm.
it's 50% words I don't understand, and then 50% abbreviations I've never heard before. So it's like, yeah,
They're trying to cover the military. That's what it sounds like to
right.
me.
It's
Right.
ridiculous. Except
Yeah.
like at least the military has, I think, legacy, so some things don't change, so you can kind of like learn it. But
Mhm.
in healthcare, it's changing daily. They're
Okay.
always moving goalposts. They're always moving things around. So, like, the thing that I would want to impart to you and to your listeners and viewers is you can start from the complete and realistic and true understanding that our healthcare system is bullshit. Right? That's it. That is fundamentally true. So starting from that point, anybody that you talk to that tries to persuade you that it isn't, what's coming out of their mouth is largely bullshit. If you talk to people that agree or that recognize that, then you're at least going to get halfway towards a solution, because they're going to acknowledge the fact that there's a big problem, and you can start engaging in conversations about how to fix things. And that's, I think, the most simple thing a regular citizen who has to use healthcare needs to know. Your doctor's probably fine, right? The person that you talk to as a doctor. And a matter of fact, if you ask your doctor, any of you, that's your homework, right? Go
Mhm.
home, and next time you have your doctor, be like, is our healthcare system bullshit? Like, they're going to be like, yeah, right. The amount of time I have to pay people to send codes and research codes to make sure that we're coding things properly to get insurance reimbursements, is absolutely ridiculous. And then, they'll talk about costs. They'll talk about having to be stuck within a particular network. And right, there's no, at any level you're going to ask, and they're probably going to answer, until you get to the levels where they're making the obscene amounts of profit that they will, is our healthcare system? Well, no, it's, our system might not be the best, but it's always innovative, right? It's always changing, right? And they'll massage the language. And at that point you can just go, no, this is complete and total bullshit. And so I think that's one of those things that I think is a simple thing for you to do as a like a regular citizen is if something doesn't feel right, if you're like, this feels unfair, you're more than likely correct. And ask somebody at that lowest level. And when I say lowest level, I'm not talking about like, I shouldn't say lowest level. Let me say closest level to the Hippocratic Oath, right? Because I don't want to say this isn't a hierarchy, but if I'm thinking of distances, right? You get the closer you get to that Hippocratic Oath, you're going to get the more real answer. And so if you think something is BS, talk to your doctor, talk to somebody like that, and just say, why is this? And trust me, you don't have to totally understand the answer, and as long as you can understand the action item. But that person at least is going to reply to you in a real way and talk to you about a real solution in the broken system.
Well, that's a good thing to know, to be able to speak to your doctor about something not directly related to your health, but to your health care. That's something I never would have thought to speak to a doctor about. So that's good to know. It's also striking to me that the reporter in me, that sense in me thinks, okay, if this can't be solved on this level, that there must be a potential political solution to it. And we know how difficult that would be, because I know what I do know about the healthcare industry is that they have a very strong lobby in Washington that keeps the lawmakers that they're lobbying flush with the kind of dollars they need to advocate on healthcare providers' behalf on Capitol Hill, and to keep them flush with our cash, right?
Yes.
I get that one right?
Yeah. Yeah. Yeah.
Okay.
I don't know if this is like the good news. It's not good news. I don't know. It's just I guess at least there's not just one force, right?
Mm.
Almost everybody's got a lobby, and the coalitions work with a lobbyist as well. And we work with various organizations. That's right. Like that's the backroom battles that we think our votes are sort of solely responsible for the moves of legislation. And the reality of it is that there are these backroom battles between opposing lobbyists, right, that are trying to persuade that poor congressman or senator that is just unfortunately wined and dined so much. I don't know how they handle it. uh they just wiping their tears with dollar bills at how difficult these
Wisconsin Senator
decisions
Joe
are.
Manchin, who's leaving office now, lives on a houseboat in DC. And I don't know how nice a houseboat it is, but that's just such a sketchy, sleazy thing for a 70-year-old senator to do. Just,
um
but yeah, go
so
ahead. Yeah,
yeah, well,
that.
I guess the practical response to that is um I you know I kind of threw out the blanket statement, right? We can't fix this. And I think that statement is really towards the total system,
Mhm.
top to bottom. And we as like employer coalitions aren't going to be able to get everybody pointed in the same direction politically, etc. That being said, we are seeing, and this is like has been my focus, because we're a 501c3, and we're limited in the way we can engage in politics and
Mhm.
things like that. And I'm not a huge like legislation politician kind of guy anyway. It's just not me. I believe that the market leads and legislation follows. And I think that like what we are seeing is when we get enough of these employers and these what we call purchasers, which are healthcare purchasers, um, aligned on what is a best practice or what should be out there and what we should be looking for, we are actually seeing market responses to that.
Okay.
And then it's really on us to make sure that they maintain market viability. There's been a lot going on in the pharmaceutical world with what are called pharmaceutical benefits managers,
Mhm.
PBMs for short, and everybody knows them. There's three big ones that almost everybody interacts with. Um, if you Google it, you'll see who I'm talking about. And they've been in trouble because there was finally attention put on the fact that the reality of our drug spend is a result of them. And these ridiculous and crazy drug prices are less a result of pharmaceutical manufacturers who offer what are called rebates, or they offer discounts and things like that to make their drugs more affordable for the patient, for the consumer. But you have these PBMs in the middle
Mhm.
that were taking those, were taking pieces of it, and not being transparent about how much money they were taking that was supposed to make it to the consumer, and only a fraction of that was making it to the consumer, and oftentimes not in the right way. So for years people have maligned pharmaceutical manufacturers. They're not completely guiltless. There's definitely inefficiencies and things that aren't great there, but these PBMs are really, really bad. And as a result of that and the attention that they got and things, we have a new market of these transparent PBMs that are coming into the market. You have Cuban with his cost plus drugs pharmacy entering the market. That is a direct result of the attention being brought to this black box of PBMs. And now it's on us, right? Now it's on
Mhm.
the employers to be like, cool, we need to do business with you so that you can stay viable, so that we're not stuck working with that old broken system. So that is one of those ways where we can actually move the needle and change things a little bit in healthcare in the US. Um, I think it's a slow turn. You know what I mean? Like if every employer tomorrow switched to one of these transparent PBMs, like Affirmed RX or whatever, like if you like went to those, Joe and Jane consumer probably wouldn't notice immediately, right? Like maybe your experience in getting your prescription would improve. That's not a very hard thing to do. I don't know if you're like familiar with NPS scores, but so NPS is like, it's a net promoter score, and it's just a
Okay.
marketing thing that people use to determine whether or not they're doing well as an organization. And it
Okay.
ranges from -100 to 100. It's one question, and it's how likely are you to recommend our goods, services, or brand to family, friends, or coworkers, right? And that question has been through a ton of like social science been determined to be an accurate predictor of whether or not people will do return business with you, right?
Okay.
And most healthcare in the U.S. is hovers in the tens, like probably a positive 10, best like positive 20, down to like -10, -20, the existing long-term organizations. Uh, One of those big three PBMs is like -92. I think it's
Yikes.
the lowest score that has ever. I should have Googled it to get you the actual number, but it is the lowest score I've ever seen in my life ever across any industry.
Serial killers get higher marks than that, right?
Yeah, right. So it's kind of crazy. So uh there's only up to go when you're starting at the bottom. So I do think there would be some feeling of change because the user experience would change. But as far as like whether or not your healthcare costs would immediately go down, probably not. But I'll tell you what, they stop going up as fast as they are. I mean, in our region, like the two healthcare systems, their one's rates went up 7%, the other one's rates went 13%. Which, if you're a large organization, maybe you can eat that without much problem. But smaller organizations that provide health insurance, that's a big increase to your payroll spend. So then you have to make a decision, right? Do I continue
Mm.
offering this level of healthcare insurance for my employees? Do I let somebody go to offset that? Right? Like these have these incredibly impactful downstream um, cost effects that are tangential just to just your healthcare, right? They're actually livelihood um,
Mm.
issues. So yeah, that's where we try to that's where we're like in the trenches and like trying to keep these things from blowing up and going too crazy.
Well, speaking of blowing up and going too crazy, I'd be remiss if I didn't ask you your take on what happened to Brian Thompson and the CEO of United Healthcare that was gunned down in New York. Clearly, there's been a lot of backlash online against this poor fellow. He was a father, after all, and a husband, and was widely regarded among his friends. Clearly, the gunman had something in mind vis-a-vis the healthcare system, because his rounds read deny, depose, and defend. Can you explain to folks what that means in the terms of healthcare?
Yeah, I mean, well, so I think the depose was an altered. I think it was a slightly different thing, right? Because I think is deny um, and delay, deny, delay, and defend is
Okay.
the typical insurance triumvirate, if you will.
Okay.
So I'll be transparent and say I had actually not even been familiar with those three because I don't come from the
Me neither.
insurance
Yeah.
provider background, right?
Mhm.
So I've never been trained as an insurance broker. I've
Mhm.
come from more the healthcare side of things. So it wasn't surprising to me, and decoding it a little bit was like, uh, I mean, those three words were not a surprise to me.
Mhm.
Um, I think it's what we've all experienced in dealing with an insurance company, which is you try to file a claim, they deny it, then they delay it, and then they defend their decision to do both of those things to try to keep from paying out. So that would be my decoding of that. I'm not 100% sure if that's exactly what they're going with, but I trust the people that I've read that have, indicated that this is obviously an individual that acted out because they felt wronged by the organization or by the individual. And I'm torn, right? I'm torn because when I hear people suffering, right? And there are various, that's a massive term that encompasses a lot, but the people in this country are suffering with our healthcare system. And there are peaks of that suffering that just exacerbates situations. And it's, you can feel the tensions of people fighting against a system that almost seems like it wants to keep them sick, and it doesn't care if they die. And if they get the care, then they're going to be burdened with years of inconquerable debt. That creates just enormous amounts of tension. And I'm incredibly attuned to that and sympathetic to that. At the same time, right, this is a human being. This is a human being that had loved ones and a family that is no longer with us. And the murder that took place it does not necessarily do any work or any service to what we already know is a problem. To me, it's a distraction, and it's a distraction that has irreversibly changed people's lives. So I can't support it. I can't condone it. I think it's an awful tragedy, but I can't also ignore that there are circumstances that are large, that are boiling up and going and like spilling over, and that these sort of desperate actions are going to happen. That's the sad thing, right? Is that things like this are going to happen because the issues aren't being resolved. And that's just, I don't know, that to me is the real depressing thing, I guess, is the shocking and scary thing, is that we've gotten to this place in our healthcare system where people think that that's somehow a viable solution, that like they're not being heard to the point where the only thing left for them to do is to do something horrific. And that's not a healthy society. and unfortunately, right, this isn't the first place in our society where we've seen that happen, right? Correct. It just seems that like we're so not being heard that we just keep returning to these places of violence to be heard. And that's, I don't want to like bring the whole podcast down.
How about it? How about this? Sorry, how about we wrap it up before we bum anybody out? This has been quite illuminating, though, and I want you to come back and keep talking about these issues. Keep talking about the problems in healthcare. Keep telling folks about the solutions they can find through organizations like yours and others throughout the country. As long as we keep talking about this, I feel like we can make a difference toward, like you said, keep moving it toward more justice, because if we don't talk about it, it's going to go back toward injustice, right? So let's keep talking about it. You keep coming back. We'll try not to bum folks out, but let's be informative and maybe crack a few jokes along the way, all right?
Do our best, yeah.
Do our best. Thanks a lot, Mike Stancil, for joining us on the show. Again, everyone, find Mike's information below, links to his columns on postindustrial.com, and we'll see you next time.